My name's Alan Williams, and I'm the Executive Director of Human Resources for Bonneville Unified School District. I do a variety of things in my office and have a wonderful administrative assistant, but it's really just the two of us that do the work for HR and also risk management as well. And so we both wear multiple hats, and it's a very diverse series of tasks and operations that we're part of. I reached out to Dr. Dupree, had heard of her very good reputation within the field of interactive process meetings, as well as a variety of other things to support districts and really, I think probably better put, support the process of working with employees who are out on leave for some type of medical or even emotional issue that they're having. And then the process, of course, as many of you know, is how to bring those people back in and really evaluate those doctors' notices that we receive. I just found within that interactive process meeting that sometimes there's the need to really have an expert, especially if you're not doing these on a regular basis. But then there's also the very challenging doctor's notes and words that we receive from a physician that really need to be carefully looked into. And I think what relationships at work does, certainly with Dr. Dupree's leadership, is really carefully evaluate the documentation prior to the meeting, but then really set the tone for the type of meeting that you want, a meeting that's positive, that's supportive, a meeting that really sets the table to listen to the employee's needs and then process that. I think Dr. Dupree's expertise comes in certainly with the law and what's allowed with under our federal and state laws and what we need to look at carefully. But also she really approaches this not just from the head, but also from the heart. And employees feel that. They don't see her as an agent of the district, but really as a third party that's coming in to support both parties in the process. And I think that having both the heart and the head that Dr. Dupree has really results in productive and positive outcomes, which can be very, very challenging situations. And I feel the times that we have used Dr. Dupree, we've landed in a very good spot. I think also very helpful to the process is the deliberate and careful IPM summary report that she provides to the district. The district has an opportunity to review that carefully. If there is areas that need to be changed or modified or adaptive, when we've reached out to Dr. Dupree, she's just really handled that well. Again, we need to make sure the summary report is true and accurate, but I think sometimes some pieces of it with some feedback from the district can be modified and still be accurate and have all the integrity that it needs to have, which is 100%. And so then we're able to take that report, send it to the employee, have them review, and it really memorializes this process that the district has done due diligence in making sure that we're in a good spot legally, but also that we have put our best foot forward to the employee and really want to be the supportive office that we are as I think about human resources. Because for me, the word gets out on how people are treated. First and foremost, we want to treat people well because that's who we are as an organization. But the word will get out how people are treated within these difficult times in their lives. And that's incredibly important for the moment, but also for as we look at the big picture of the district and as we move forward in time.